Nursing MCQs 2025. Which electrolyte is a priority in cardiac arrest? Sodium, potassium, magnesium, chloride. The correct answer is option B, potassium. Which oxygen delivery device provides the highest concentration of oxygen? Nasal cannula, simple face mask, Venturi mask, non-rebreather mask. The correct answer is option D, non-rebreather mask. Which test is used to detect malaria? Rapid diagnostic test, PCR test, Weddell test, none of these. The correct answer is option A, rapid diagnostic test. Which condition is associated with a water hammer pulse? Aortic stenosis, mitral stenosis, aortic regurgitation, tricuspid regurgitation. The correct answer is option C, aortic regurgitation. Which type of urinary incontinence is caused by increased intra-abdominal pressure? Urge incontinence, stress incontinence, overflow incontinence, functional incontinence. The correct answer is option B, stress incontinence. Which type of hypersensitivity reaction occurs in contact dermatitis? Type 1, type 2, type 3, type 4. The correct answer is option D, type 4. Which cardiac biomarker is most specific for diagnosing a myocardial infarction? Myoglobin, LDH, troponin, none of these. The correct answer is option C, troponin. Which hormone is responsible for stimulating the release of cortisol from the adrenal glands? Thyroid stimulating hormone, adrenocorticotropic hormone, antidiuretic hormone, luteinizing hormone. The correct answer is option B, adrenocorticotropic hormone. Which hormone increases blood glucose levels during stress? Insulin, glucagon, cortisol, aldosterone. The correct answer is option C, cortisol. Which type of hypersensitivity reaction is anaphylaxis? Type 1, type 2, type 3, type 4. The correct answer is option A, type 1. Which findings suggest hypovolemic shock in a trauma patient? Warm plush skin, narrow pulse pressure, decreased respiratory rate, bradycardia. The correct answer is option B, narrow pulse pressure. A patient with Addison's disease is at risk for which life-threatening condition? Hyperglycemic state, diabetic ketoacidosis, adrenal crisis, none of the above. The correct answer is option C, adrenal crisis. Which condition is caused by excess growth hormone in adults? Dwarfism, acromegaly, gigantism, Cushing's syndrome. The correct answer is option B, acromegaly. The injection of a drug directly into the joint is called intra-articular, intrathecal, intravenous, subcutaneous. The correct answer is option A, intra-articular. Which cranial nerve is responsible for controlling the lateral movement of the eye? Optic nerve, oculomotor nerve, trochlear nerve, abduction nerve. The correct answer is option D, abduction nerve. Which ECG change in characteristics of hyperkalemia? ST diffraction, peak T waves, prolonged QT interval, U waves. The correct answer is option B, peak T waves. Which electrolyte imbalance is most commonly associated with prolonged vomiting? Hyperkalemia, hypocalcemia, hypokalemia, hypernatremia. The correct answer is option C, hypokalemia. What is the primary reason for using heparinized saline in central lines? Improve drug absorption, maintain line patency, prevent extra vegetation, minimize infection risk. The correct answer is option B, maintain line patency. Which of the following is a characteristic feature of Cushing syndrome? Moon phase, polyuria, tetany, none of these. The correct answer is option A, moon phase. What is the most common site of atherosclerosis? Coronary arteries, femoral artery, carotid artery, renal artery. The correct answer is option A, coronary arteries. Tuberculin test is used to diagnose typhoid, tuberculosis, malaria, hepatitis. The correct answer is option B, tuberculosis. What is the mechanism of action of penicillin? Inhibits protein synthesis, disrupts cell wall synthesis, inhibits DNA replication, blocks folic acid synthesis. The correct answer is option B, disrupts cell wall synthesis. Which neurotransmitter is primarily involved in the parasympathetic nervous system? Dopamine, serotonin, acetylcholine, norepinephrine. The correct answer is option C, acetylcholine. Which hormone is responsible for stimulating red blood cell production? Renin, erythropoietin, aldosterone, antidiuretic hormone. The correct answer is option B, erythropoietin. Which lung volume remains in the lungs after maximal expiration? Tidal volume, inspiratory reserve volume, residual volume, functional residual capacity. The correct answer is option C, residual volume. A nurse is administering a beta blocker to a patient with hypertension. Which of the following assessments is most important before giving the medication? Blood pressure and heart rate, respiratory rate and oxygen saturation, temperature and urine output, fan level and pupil size. The correct answer is option A, blood pressure and heart rate. Which carbohydrate cannot be digested by humans? Starch, sucrose, cellulose, glycogen. The correct answer is option C, cellulose. Thanks for watching. Subscribe to the channel for the latest informative MCQs.